menstrual problems are what we're going to be talking about here. I'm Dr. Scott Fuller. Menstrual problems are going to include pain, cramps, headaches, ovarian cysts, uterine fibroids, endometriosis, all of that grouped together. And I'm going to offer you some conservative solutions. I'm going to be talking about a case in a moment, the things that we did to help her, which is going to give you some options at home. And I'm going to list some other things that have worked for other patients in the past, so you can look at this list and try some things. First of all, if you have any menstrual problems, pain, swelling, bleeding, things getting worse, difficult periods, whatever it might be, and if you have not had an examination from a physician or a gynecologist, the first thing I'm going to tell you is get an examination, and get an examination now. Make sure it's comprehensive. They're going to do all the right things. They're going to do the physical exam, maybe blood tests and urine tests, and maybe they have to go further. So make sure you do that first before you move on to conservative options, right? You heard me, right? Examination first, rule out any big bad things that you need to know, and then we move on to some conservative options. Okay. So the case that I'm going to talk about here is a 24-year-old female, patient of mine in my chiropractic office in Woburn, Massachusetts. She has painful periods. The painful periods include headaches around the period time. She also gets headaches at ovulation time, so 2 bad headaches per month classified as migraines. She's been diagnosed with endometriosis. Endometriosis, as you know, is the inside of the uterine lining growing outside somewhere else where it's not supposed to be. Just as a side note of that, I like to engage in discussions with my women patients, my female patients, and saying, what is an ovarian cyst? What is a uterine fibroid? What is endometriosis? It is cell growth, tissue growth. So who put it there? Your body put it there, because all it is cell growth. Well, who's best to make a change in that physiology? Your body is. Well, there's somewhere in there a breakdown in your physiology. Our job together, working together, is to try to improve your physiology. So if your body is malfunctioning some sort of way, our job is to try to improve that malfunction so your body can get rid of these things, or at least not produce them again. I am never going to say to someone, don't have surgery for some certain thing, but if you have a fibroid taken out or a cyst taken out, is that addressing the cause of the problem? And one might think that, well, no, because if the body is malfunctioning and grew it, who's to say that it wouldn't grow another one? Again, I'm not saying don't have it removed, but at least think about what's going on there and what needs to change, okay? So we're going to talk about improving the physiology to see what we can do to make some changes. So this woman is a patient of mine. She's been coming to me in 2018, and she came in because of neck pain and headaches and so forth. Then we started engaging into the discussion of the painful periods and endometriosis. So we did 4 main things, and I'm happy to report to you that her pain and difficulty with her periods is already 50% better in just a few months. Here's what we did. Number 1, chiropractic care. I'm a chiropractor. So a lot of women have come to me, whether they're in their teenage years or 20s or maybe 40s and 50s, and when I start working on them, their symptoms of menstruation get a lot better. It's not the answer for all women, of course, but a lot of women have noticed some really nice changes. They've noticed changes where a lot of women, if they're under maintenance chiropractic care, and let's say that they're coming in once a month or twice a month, once a month is very common, they will time their chiropractic visit shortly before when they know they're going to get their next menstrual period, because they find that if they receive that adjustment, they get through their menstrual issues better that particular month. Do you follow? So some women will time it in that way. Now, how does the chiropractic thing work? Just remember that chiropractors activate high threshold joint mechanoreceptors in an effort to barrage the spinal cord, cerebellum, and cortex with this mechanoreceptive afferentation, which improves the neurological distribution of the cerebellar, cortical, thalamocortical pathways to allow in descending appropriate regulation of the sympathetic nervous system. Okay? Well, I just said a bunch of neurological garbage to you. In other words, what a chiropractor does is we improve the information in to improve the information out. Does that work in every case? No, but when we improve the information, we give the body a better chance to improve the information out and regulate hormones, growth or non-growth of cells, the physiology, and all the other, the endocrine system and so forth, okay? So that's what a chiropractor does. Better in, better out. She noticed, heck, my neck, upper back, and lower back problems are getting better, my headaches are getting better with chiropractic care, and I noticed some improvements with my period. But then she said, I'm not getting a lot better. What else do you have for me, Dr. Fuller? And I said, number 2, I want you on a dairy-free diet. Saying this for 28 years to my patient population, if you had to make one nutrition change right now that's free with no downside because you're not missing any of the nutrients, a dairy-free diet. A dairy-free diet means nothing from a cow. What is that? No milk, no cheese, cottage cheese, yogurt, ice cream, cream, butter. Eliminate that for a couple months, I'll say 3 months. Eliminate that for 3 months and see what happens. I have done a lot of shows on this. Go to my YouTube page, check them out. She did the non-dairy thing and she said, definitely made a difference. Just as a side note, you can also go to an anti-inflammatory diet. An anti-inflammatory diet would include a few more things to expand if you need that. It's kind of like the no dairy, no gluten if you live in the United States, because we mess things up here. Definitely little to no sugar. Reduce the processed foods, increase your vegetables, make sure that your animal products, if you're eating those, are non-hormone, non-antibiotic, non-GMO, and all that kind of stuff. Anti-inflammatory diet. Got it? Okay. So that's the nutrition change that she made, and that helped her. The third thing we said was magnesium. Now, I have a magnesium product here. You don't have to get this one. The reason I'm saying this orthomolecular product, orthomolecular products is the company, and their product, magnesium product, is called Reacted Magnesium. Over the past 6 months, I have given this to many dozens of my patients with awesome changes. Not just women with menstrual issues, but we're talking restless legs, cramps, heart arrhythmias, difficulty sleeping, difficulty getting to sleep, difficulty staying asleep, focus, concentration, pain, joint issues, and so forth. A lot of great improvements. With only rare circumstances of people not tolerating this well, I can only think of 2 people. One, both of them have IBS, and we were able to work with other magnesium products that are out there as well. Okay, so these 2 canaries in a coal mine with IBS had to change to another magnesium formula. So that was the third thing that we did. Just keeping in mind the magnesium form matters, so you have to read labels. The magnesium forms that work are magnesium malate, magnesium glycinate, magnesium threonate. Magnesium citrate may or may not work for some people. Some people with magnesium citrate tend to get loose bowels if you take too much, so just be aware of that with citrate. Magnesium chloride is another one, so keep that in mind. Magnesium oxide is one that I do not recommend, and other practitioners feel that way, as do I. Remember the magnesium guru, Dr. Carolyn Dean. That's her website, drcarolyndean.com. If you want to read more about that, she wrote the book Magnesium Miracle, fantastic book. The fourth thing that we did for this 24-year-old female is we reduced her personal chemical load. I just did a show on that. Go to my YouTube page, Reducing Your Personal Chemical Load. We reduced the phthalates, the estrogen mimickers, the phytoestrogens, and so forth. Personal chemicals that, when we're exposed to them, makes us more estrogen dominant, which can lead to all of those things that I explained earlier, the painful periods and endometriosis and cysts and fibroids and everything else. So reducing personal chemical load, limiting and eliminating plastic that touches your food, plastic drink containers, and so forth. Getting rid of the plastic containers in your refrigerator and replacing that with glass. Never microwaving in plastic dishes or plastic saran wrapped. Then looking at our personal care products, makeup, lotions, soap, shampoo, conditioners, laundry detergent, cleaning chemicals around the home. I covered all of that, limited that. She said that made another difference. The last thing that she has tried is apple cider vinegar capsules. I'm a fan of apple cider vinegar. She's taking capsules. It's difficult to say how much that helped her because all the other things have been helping her. Remember, this has only been a few months. She's noticed a 50% reduction in the difficult, painful periods that she's been having. So that's pretty cool with those main things. The chiropractic care, dairy-free, magnesium, and reducing her personal chemical load. Very cool. No downside for anything that I just said, only great potential upside. Agreed? Then I made a list of a few things that if you needed more, if you tried some of those things and you wanted to go further, here's what I recommend. Go to Dr. McDougall's website, drmcdougall.com. In his search box, you can put in endometriosis or ovarian cysts or uterine fibroids or painful periods. And he'll direct you to articles and especially case studies of women that had terrible problems in these areas. And with his dietary changes, have noticed some really, really great improvements. So drmcdougall.com. Number 2 is Dr. Axe, draxe.com, AXE. Go to his website. I just poked around today before today's show. He's got a couple of good articles in there, specifically talking about the anti-inflammatory diet. He doesn't get into some of the other things that I talked about, but that's also a good resource. Number 3 is essential oils. Essential oils. Now, my colleague, Dr. Heidi Hendrickson-Zahn, she has a great website that I was poking around today that can talk about other options, including essential oils. drheidywellness.com. If you want to look at essential oils, not only for these issues that I'm talking about, but all kinds of other things too. And again, plant-based products, no downside, only potential upside. Number 4 is something called food sensitivity testing. You can have your blood drawn, sent to specialty labs around the country, there are many, and you can have your blood tested against foods to find out which ones you might be sensitive to. A couple of labs that I've used is Alletess, ALLETESS.com, Alletess Labs. Put it into Google, you'll see it. Alcat.com is another one, and there are many, many others. Okay? Food sensitivity testing, and that has helped dozens and dozens of my patients as well, finding that out. Again, not just for period issues, but lots of other health issues as well. Next is, of course, reducing stress, right? How many women do you think I talked to that said, do you find that stress aggravates the symptoms of menstruation? They're like, yeah, all of them, right? So working on reducing stress, working on changing your perception of the pressures that you have around your life, and I have done show after show on that, and there are so many nice things that you can do to make a change there. One place I recommend you go is to Dr. Kelly Brogan's website, kellybroganmd.com. Look at her information. She is a holistic psychiatrist. Great stuff, and then she'll lead you to videos, and then that will lead you to other great things and so forth. Of course, exercise, regular physical exercise improves your physiology, changing every cell in your body, and then enough and regular sleep. I can't tell you how many people are shortchanging their sleep. If they improve their sleep, great things happen. If anything in this video has helped you, and you're watching this on YouTube, give us a thumbs up. Give us a thumbs up. And please, by all means, please subscribe to our tribe, and that's going to give me motivation to put out more information like this. You can also make a comment. Comments will help others, and it will also help navigate future shows to help you. I'm Dr. Scott Fuller. Please join me again.